Welcome to Phase 3, Stage 1, Communicate a Case Study. As a reminder, there are challenges to complete. Please stay engaged. Please complete these challenges so that you can reap the most benefits from your investment. Speaking of challenges, here's your first challenge. It's a self-perception quiz on communication skills. So if you take a look at your modules, this is going to be a separate link on your main page underneath modules in the course content. The self-perception quiz is the same quiz. You'll take the exact same quiz, exact same link right now and at the end of this phase so that you can see if there's any differences in your level of confidence, and I would love to see that as well. Complete this quiz for the first time. You will rate yourself on all qualities of communication. You will receive your results in your email for further review. Save the email. Please save the email. At the end of this unit, you will retake this assessment to determine if you have improved perception of your communication skills. Another thing I want you to keep in mind as you're taking this quiz is to understand the different components of communication and what would make you a strong communicator versus having room for growth. And we all have room for growth, right? But knowledge is power, and when you know what qualities you can improve, then that will allow you to watch for opportunities to improve them and to become a stronger communicator. So delivering a case study. The first thing is leveraging the power of storytelling. Take the listener on a journey from start to finish in a succinct and concise manner. Use appropriate vocabulary for your audience. So you do need to know who your audience is. Are you speaking to students? Are you speaking to your team, maybe an interdisciplinary team that you work with? Are you speaking to an audience of scholars who are attending your meeting for a lunch and learn? What are you doing? Who are you presenting to? That will change the way you communicate your case study. And case studies can be formal. So it could be in a formal capacity where you have been asked to attend a conference and you're presenting a case study, or it could be something that's informal where you're at a lunch meeting and you are quickly going through your caseload and you have to give a rundown on a complex case to get feedback, to give feedback, right? So it could be formal or informal, both relate to a case study. The most important takeaway here is the power of storytelling. Don't get too in your head about meeting all of your marks, right? Everything that you do is taking someone on a journey. As I'm learning how to write more scientific literature, the biggest piece of advice I'm given by other scholars is, yes, you're presenting your data, but you're also telling a story. Your paper should always tell a story. You should take your reader on a journey through your experience and help them to be engaged in what you're speaking about. So what do you include in a case study? Here I just want to give you a brief reminder to print out the case study. You'll see this in the module. It's a sheet that looks like this. This is going to take you through all of these elements and make it easier for you to communicate. For example, a challenge that's coming up or just to present in your day-to-day life as well. So do take the time to print that out. If you can't access the link, you can always go right to the Google Drive. You can print it out there as well. So what do you include in a case study? First off, an introduction. Begin by introducing yourself as the new practitioner and providing a brief background about your role and experience. Or if, please, take this in stride. If you are not a new practitioner, you do not have to introduce yourself to a group of familiars, right? You don't need to. If everyone's familiar with you, then, this is just an idea to get you started. Introduce the patient by sharing their first name, if appropriate, and relevant demographics such as age and sex. A lot of presentations, formal presentations, will require you to de-identify your client, so making sure that there is nothing that is going to tie the presentation back to them to protect their identity. Patient background. Present the patient's diagnosis, explaining the condition in simple terms for the benefit of the audience. Never assume that they know. But if you have a defined audience and you know who you're going to be speaking to, it is safe to assume some baseline of knowledge. But know your audience. I'll leave it there. Provide an overview of the key symptom manifestations that the patient is experiencing. Focus on significant symptoms that are relevant to the case. I like to focus on symptoms because the symptoms tell a story, and a lot of my work is done in looking at symptoms that have a relationship with my patient's primary and secondary diagnoses, because sometimes there is a secondary condition that has a symptom that is actually being exacerbated by the treatment of the primary condition, right? So that's why we have to know secondary and primary conditions, or primary and secondary conditions and symptoms, the symptoms that relate to them, so that we can advocate for our patients. Notable mentions. Highlight any relevant medical history or comorbidities that may impact the patient's current condition and treatment plan. Discuss any recent changes in the patient's health or treatment that are noteworthy. Social environment support. Explain the level of social and environmental support the patient has at home and in the community. Mention any caregivers or family members who are actively involved in the patient's care. I think we really need to make a point to shine here. In the facilities I have been able to work, mainly a medical rehab unit and skilled nursing facilities, I don't know if there's anybody that is actually dedicated to watching out for these clients' environmental and social factors. It's briefly discussed, but never something that drives discharge planning. And it needs to. It needs to be a weighted factor in discharge planning. And I think OT, being practitioners who are heavily biopsychosocial and practice under like the PEO and PEOP models, we have to be doing a better job advocating and speaking up for our clients when they lack social support, or if they are having difficulty, or if their social support is having difficulty coping with health lifestyle changes of our patients. That's a role that we really should be playing because we see it very clearly. Patient goals. Clearly state the patient's short-term and long-term goals. These should be specific, measurable, achievable, relevant, and time-bound. There is a whole training on the SMART goals, so please do watch that. If you're a Thrive member, you have access to this course that's included in your membership. So take advantage of that, watch that course, and get more familiar with the SMART approach. Even if you know it and you think you know it, it's always good to hear another person's perspective of it. So next is specific strategies to reach goals. Outline the specific occupational therapy strategies or interventions that have been implemented to help the patient achieve their goals. Discuss any modifications and adaptations made to the patient's environment to support their goals. Current status in their plan of care. Provide an update on the patient's progress in their plan of care and share any recent assessment findings, changes in symptoms, or improvements in functional abilities. Personally, I would always use objective measures because I found it was the only way I felt more confident speaking up. In a room full of people who always, who tended to, I shouldn't say always, that tended to devalue the OT mindset. OT never really drove discharging, never drove the conversation. We were always the accessory. Other professions really drove whether or not someone would remain on service. I liked to stay close to objective measures because then I felt confident that what I was saying was of value and worth it. Have a question and discussion element if you have time. Encourage the audience to ask questions or seek clarification on any aspects of the case study. Be prepared to provide additional information or evidence to support your assessment and treatment approach. And finally, offer a conclusion, summarizing the key points of the case study, emphasizing the patient's diagnosis, goals, and progress. Express gratitude to the group for attention and engagement. Remember that clear and concise communication is crucial when presenting a case study to a group of medical professionals. Practice beforehand to ensure you can confidently and effectively share the patient's information and progress. Additionally, always maintain patient confidentiality and seek their consent before sharing their case with others. It is always good to get your patient's permission, even when you're de-identifying it. Before you shared their personal journey, it's always important to have that conversation. You see some patient videos and images that we may use on social media. Very important to have a conversation about using that person's information and how and in what way that information will be used. All right, second challenge. So this is a two-part challenge. The first is set a timer for a maximum of 1 minute and 30 seconds to clearly and concisely communicate your case study so that the group can envision a clear picture of your patient. Use your phone or other recording device to capture your delivery of a case study following the template given. Now this goes back to the PDF that I had mentioned earlier. You can scroll down to the bottom of this module and go ahead and click the link and print it out there. This can be your own case study, so a personal example, or using one of our practice case studies, also included in the module. The more you upload and practice, the easier it will become. So you can do more than one. Have at it. Everybody will benefit from it, so please do consider doing more than one. Provide encouraging feedback for your fellow group members. Go to the community board for this phase 3 circle and comment on videos that may be posted or texts. Listen to them thoroughly to be inspired as you prepare to do your own videos for practice. So at this time, I want you to stop the video, head to the case study planning sheet and the 27-page document of different case studies to follow, and try your first case study while it's still fresh in your mind. I would encourage you to post a video versus a text, but go at your own pace. Always push yourself for excellence. Okay, I'll see you in stage 2.